African Trypanosomiasis, a disease that has plagued this vast continent for decades, from travelers to merchants to residents. No one is safe. This disease yields to no one. A bite from the tsetse fly is all it takes for infection to occur, as one man has devastatingly learned.
A 25-year-old previously healthy South African male travelled to Tanzania on an 11-day safari. After a week of leaving the mainland Tanzania and a day after his return to South Africa, he started developing a fever and a severe headache. Other evaluations, including a chest X-ray and a brain CT, as well as a lumbar puncture, were all normal. Physical examination was unrevealing except for a small purplish painless lesion on the patient's forearm. This was considered a possible eschar, and the patient was started on doxycycline for the proposed diagnosis of African tick bite fever. However, the fever, headache and vomiting continued unchanged, and the cutaneous lesion grew in size. Concern was raised for the possibility of human African trypanosomiasis. After nearly a week, the patient's fever and headache resolved and the blood count was normal, and the patient was discharged from the hospital. He remained asymptomatic for 10 days afterwards, when fever recurred for 2 days and resolved spontaneously. Physical exam showed healing of the cutaneous lesion and was otherwise negative. A week later, the patient had returned with a 3-day fever, and on physical examination, the patient had enlarged lymph nodes, which is indicative of Winterbottom sign. The patient appeared to be irritable with tremors and increased muscle tone. The patient was then readmitted for further testing when he went into a state of stupor and experienced seizures. A diagnosis of human African trypanosomiasis was made. The drug of choice is usually eflornithine ornidol. However, due to this being the East Human African Trypanosomiasis disease, this disease responds weakly to this drug, so alternatively, the patient was put on pentamidine. Although this drug does have undesirable side effects, the patient made a full recovery.
We're in a trip with a friend who went unprepared, and he only relied on using the insect repellent, which is proven not 100% effective on the tsetse fly bite. My friend was wearing a shorts, sleeveless shirts, and we're in the bushy areas, so we suspect that he might be bitten by the insect while we're in the area.
After the patient's first visit to the doctor, we did some routine laboratory tests. From the results, we found that the patient had anemia and high levels of C-reactive protein.
We also did some additional tests that included blood cultures and Plasmodium and Borrelia PCR. These results were all inconclusive, so therefore we advised the doctor to treat the patient according to the symptoms.
After the patient's second visit to the hospital, we found that the presenting symptoms gave us a better understanding of the disease. I conducted a blood analysis using an unstained blood smear, and the results showed that the organisms were spindle-shaped. They had a central nucleus, they had free flagellum, as well as an undulating membrane. These organisms resembled the morphology of the parasitic disease trypanosomiasis.
To be more specific, I cultured the patient's blood on Weinmann's medium so that we could detect the epimastigotes. The cultured epimastigotes were then inoculated into a laboratory animal, where after about a week we did blood tests on the animal's blood, and we found out that the nucleus of some of the trypomastigotes moved to the posterior end. This phenomenon is typically seen in Trypanosoma brucei rhodesiense, and therefore we advised the doctor to diagnose the patient with East African Trypanosomiasis.
Both forms of sleeping sickness are transmitted by the bite of the tsetse fly. In East African sleeping sickness, it's transmitted by the Glossina morsitans. Tsetse flies inhabit rural areas, living in the woodlands and thickets that dot the East African savanna. Tsetse flies bite during daylight hours. Both male and female flies can transmit the infection, but even in areas where the disease is endemic, only a very small percentage of flies are infected. Although the vast majority of the infections are transmitted by the tsetse fly, other modes of transmission are possible. Occasionally, a pregnant woman can pass the infection to her unborn baby. In theory, the infection can also be transmitted by blood transfusion or sexual contact, but such cases have rarely been documented.
So I went on a trip to Tanzania. I had a whole safari planned. Took my friend with. We had such an adventure. Came back home a week later. Wasn't feeling too well. Started getting headaches. Went to the doctor. The doctor prescribed some medicine. They made an initial presumption. I don't know what it was. After the medication they prescribed, still wasn't feeling better. Went back to the hospital a second time. They did some more tests. I started feeling worse, just couldn't walk straight. The headaches were worse, nausea. I can't even begin to describe what I was feeling. They gave me some more medication. I went home, wasn't feeling better. I can't even remember how long I waited, and then the seizures started. Seizures, and then the next thing I knew, I was waking up from a coma. So I don't actually know what happened after that, but I think this was just a bit traumatic, and looking back, I would I would just be more precautious, maybe take the advice of my friends, not exposing my body too much in Tanzania, even though it was so hot, you can't not wear shorts, it was very hot. But I wouldn't do it again. Terrible experience after this.